Hi, good day. My name is Pacha J. Sahid. So for this video, I will be going to demonstrate and perform the abdominal assessment. So the equipment needed for this procedure is a warm stethoscope, ruler, a mark pen, a clean gloves, and also a small pillow, and of course the hand sanitizer. So the first step for the preparatory phase is we must obtain nursing history and general health survey prior to procedure, and then maintain the privacy and proper draping. So to maintain the privacy of our client, we must first close the door or the curtains if any, and then we're going to introduce ourselves and explain the purpose and procedure to the client. But before that, we must first sanitize our hand to prevent infections control. So now I'm going to introduce myself to the client. So hi, good afternoon, sir. My name is Pacha J. Sahid, and I will be your student nurse for today. So sir, may I ask your name?
My name is Nagapang,
Okay. So sir, how old are you, sir?
25 years old.
Okay, sir. For your health history, sir, sumasakit po ba yung tiyan nyo?
Hindi po.
Madalas po kayo mag-diarrhea? Okay, for your family history, sir, mayroon po ba na operahan na ng appendix?
Wala po.
Okay, that's good. So, sir, in this assessment, I will be going to assess for your abdomen and check for any abnormalities or any problems. So I will be going to palpate and percuss your abdomen. So is it okay with you, sir?
Yes.
Okay, thank you so much, sir. So now we're going to start the procedure.
Yes.
Before we start the procedure, we must first sanitize our hand and wear clean gloves. So the first step is we're going to assess our patient in a supine positions, and with the pillows under the head and the knees, and then we're going to expose the abdomen from the breast to the symphysis view waist, and the bladder should be empty. And then after that, we're going to use our warm hand and have a short fingernails, and we're going to stand at the client right side, and then we're going to start the LUQ progressing clockwise through the 4 abdominal quadrant. So sir, hihiga po kayo, sir, but before that, naiihi po ba kayo, sir? Okay, sir, can you please higa for me? Okay, sir, thank you. And then I'm going to use this pillow under your knees po. Okay. Okay. And then sir, I will going to expose your abdomen po. Is it okay with you, sir?
Yes.
So now after that, we're going to inspect the skin for the color, the venous pattern, and integrity. Okay, so the color is normal. So okay, and then after that, we're going to compress a 2 finger next to each other, and then remove one other finger and observe for feeling. And then after that, we're going to repeat the procedures and by removing other finger. Okay, so now we're going to proceed to the inspect for the umbilicus for the pulsations and the color. Okay, so that's good. The position is in the right positions, and then now we're going to and observe for the abdomen. For the abdomen, the for the contour, the symmetry, and the surface motion. Okay, sir, I will just going to observe for your abdomen. Can you please? Okay, okay, okay. So that's good. And then after that, we're going to observe the color of stools and the MSS. Okay, that's good. So now we're going to go to the right side of our client. So now we're going to auscultate. We're going to auscultate using this stethoscope, using the diaphragm of worm stethoscope. We're going to use the diaphragm to auscultate for the vowel sounds, and then we're going to observe for the sounds, and then after that we're going to use the bell of stethoscope to listen for the vascular sounds, and if the broads are here, we're not going to palpate the abdomen. So, sir, i-auscultate ko lang po yung tiyan niyo, sir, ha? Okay. Okay, that's good. And then after that, we're now going to percuss the all four quadrants for percussion tones. So, sir, magpa-percuss lang po ako, sir. Is it okay?
Yes.
Okay. Okay. And after that, we're now going to percuss for the liver of span, starting the umbilicus at the client right side, right mid-clavicular line, and then we're going to percuss upward until we hear the dullness, and we're going to mark that point, and then after that, we now proceed to percuss the downward at the from the long resonance in the right mid-clavicular line until we hear dullness, and then we're going to mark, and then we'll repeat the procedure in the mid-sternal line. So, sir, mag-percuss lang po ako, sir. Is it okay? That's good. And then we're now going to percuss the spleen, percuss dullness downward in the left mid-axillary line, beginning with the resonance until you hear splenic dullness. So, sir, magpa-percuss po ako dito sa left side niyo po. Sir, can you please raise your hand? Okay. So, magpa-percuss po ako, sir, ha? And then after that, we're going to the splenic percussion signs, and we're going to ask the client to inhale deeply and hold your breath. And then we're going to percuss the lowest interspaces at the left anterior axillary line. So sir, magpe-percuss po ako ulit sir. But before that, can you please take a deep breath sir? And then hold po. Okay, so next, we're going to lightly palpate the all four quadrant for the tenderness, the consistency, and masses. And we're going to observe for the facial expressions of our client. So sir, mag-percuss po ako. Ay, mag-palpate lang po, sir. Okay. And next is we're going to deeply palpate all four quadrants for tenderness, guarding, and masses. And we're going to use deep palpations with cautions and examine the tender areas last. So sir, magpalpate lang, palpate ulit ako sir ha. Okay, that's good. And then next we're now going to palpate the liver border using the liver border for the tenderness and masses and consistency. Sir, mag-percuss lang ulit ako, sir. It will locate at the right costal margin. Sir, masakit po, sir?
Hindi po.
Okay, that's good. So after that, we're now going to palpate for this splenic border using the bimanual technique, and we're going to check for the size and the tenderness. So ulit sir, magpalpate ulit po ako sir ha. Dito banda po. Sir, masakit sir?
Hindi po.
Okay, that's good. And then we're now going to deeply palpate the kidney using the bimanual technique, and then we're going to assess for the tenderness and masses. So sir, magpalpate lang ulit ako sir ha. Okay. Okay, so now it's good. And then after that, we're now going to the Manweaver test. So the first is we're going to measure the abdomen from the girth at the same point every day. And then we're now going to the next is the fluid web test. So sir, ilalagay ko lang po yung hands dito tapos pa ganyan. Okay. Okay. Thank you sir. And then after that, the shifting dullness. So sir, magpe-percuss lang ulit ako sir. Is it okay sir? Sir, pwede po ba kayo tumagilid sir? Okay sir, thank you so much sir. And then now we're going to the test for the appendicitis. And then next, rebound tenderness and quickly withdraw the palpating hand. So sir, magpapalpate ako sir ha. Sakit sir?
Hindi po.
Okay, that's good. And then next is the fistula sign. So we're going to put the pressures on the thigh of our client right legs, and then the legs is raised, naka-raised po. So sir, maglagay pa ako ng pressure dito sa legs na itaas niyo po yung paa niyo sir ha.
Yes po.
Pakitaas lang ka. Okay, that's good. May masakit po sir?
Hindi po.
Okay, that's good. And then next, the obturator test. We're going to flex rotate the right legs of our client. So sir, i-rotate ko lang po yung legs niyo sir ha. Is it okay sir?
Opo.
Okay. Sir, may masakit po?
Wala po.
Okay, that's good. So now we're going to test for the acute cholecystitis test. We're going to place the thumb below the right costal margin, and then we're going to ask client to deeply inhale. So sir, mag-palpate po ako, tapos for mag-inhale po kayo sir ha. Okay, that's good. And lastly, the test for asteriosclerosis. So it is we're going to dorsiflex the client rest and with the fingers extended. So sir, this is the last test sir. Can you please sit down for me? Wait lang. Okay. Okay, that's good. Okay, sir, can you please your hands forward po? Masakit, sir?
Hindi po.
Okay, that's good. Thank you so much. So that's all for today, sir. So before we end this, we must first return the equipment we need to the appropriate locations. And this, we're going to take off our gloves. And of course, sanitize our hands. So for the document finding, I don't see any abnormalities or masses on the abdomen of my client. So sir, the result is normal. You don't have to worry. The tenderness and your abdomen is normal. Wala namang problema. Wala namang mga masses and any tenderness. So that's all for today, sir. Thank you so much for the cooperations. God bless. So that's all. Thank you.